All right, it is that time of year. It is open enrollment for Medicare. And if you're 65 and eligible for Medicare, you do need to enroll. And even if you don't think you need the benefits, you actually need to sign up. So our Medicare and health insurance experts are here to talk everything you need to know about enrolling in Medicare, and also the ACA healthcare enrollment period is coming up as well. Catherine CVA from AARP, Steve Edmonds from Alliance Insurance Services will be taking your questions. And this is how you get your question to them. You're going to text us that question, 336-379-5775. All right, so Steve, let's first talk about this. It's open enrollment for Medicare. Let's talk about that. When it started this week? How long does it go for? Who needs to know about it?
Okay, so Medicare open enrollment, it started on October the 15th on Tuesday, and it will run through December the 7th. So, it's about 8 weeks there. During this Medicare open enrollment period, it allows Medicare beneficiaries to do a lot of things. They can, number one, they can switch between Medicare Advantage plans. So they could drop a plan and pick up another one. They can also switch their prescription drug plans. So if they're just on original Medicare and carry a prescription drug plan, they can change it during Medicare open enrollment as well. Another thing that they can do is they can change from original Medicare over to a Medicare Advantage plan during this time period. And they could drop a Medicare Advantage plan and return to regular Medicare during this period of time. So a lot of moving parts there, but the bottom line is Medicare beneficiaries have a lot of options right now. So that's a good thing.
All right, so if you're already on Medicare, this is your open enrollment time to change things, this, that, and the other. Now, if you're not on Medicare yet, but maybe you should be, this is not the time that you automatically enroll. So Catherine, let's talk about when people have to sign up for Medicare.
So all of us need to enroll in Medicare as we approach our 65th birthday. So 3 months before the month of our birthday, or up to 3 months afterward, we all sign up for Medicare. And that's the general Medicare coverage that includes Part A, which is our hospital coverage, Part B, which is at least at 65, can be optional, but covers things like clinic visits, x-rays, pharmacy, those kinds of things.
Okay, and so we had that graphic up 3 months before the month of your birthday or 3 months after. Now, some people will say, I'm still working, I don't really need Medicare. And the answer to that is what, Catherine?
The answer is, if you are still working and you have insurance that is a credible program, so that means that your insurance from your employer meets the criteria for Medicare, then you can waive or you can defer Part B until you retire. But you must do that, or if you don't, you will face a penalty when you go to enroll at some later date. So you have to hit that deferral box. All right, to make sure that you're not going to be penalized.
Okay, and when she says penalized, we don't mean like, hey, one time you're going to pay more of a fee. We're talking about, Steve, this is a lifelong penalty that you're going to pay.
It is a lifelong penalty, and it's two different penalties. On your Part B, as B is in boy, on Part B, you can be penalized up to 10% per year. So that can really add up over a period of time. On your prescription drug coverage, you're penalized 1% per month that you go without coverage. So if you went without coverage, say 4 or 5 years, that could be 48, 60% or more, So it can add up over time for sure.
Okay, well, we've got a couple questions coming in already. And again, the number is down there at the bottom of your screen. So Catherine, this person says, if my wife is 65, but she's covered on my health insurance, should she enroll in Medicare?
Absolutely. Absolutely. There is no person who is exempt from enrolling in Medicare at 65, even if they have the greatest coverage in the world.
So let's be really clear about this. If she enrolls in Medicare, that doesn't mean she has to give up the good health insurance that her husband has.
That's right. That's right. She doesn't have to give anything up. She just has to make sure she's in the system, so that when that insurance looks at payment for something, they can matriculate with Medicare, and she will have it when he retires, and they both need to be covered by Medicare first.
Right. All right. And so for this specific question, that 65-year-old on her husband's insurance, she has to sign up. Otherwise, she's going to get penalized for the rest of her life until she needs it. So that would be a problem. All right. So Steve, this person is asking, do I have to make a new selection with Medicare if I don't want to change my plan?
You don't. Like if you have current insurance going now, you do not have to make a change, and your plan should automatically re-enroll for 2025 and just keep right on going. But here's the thing. There's no reason not to investigate your plan and to do some checking, because 2025 is one of the most, we're seeing more changes than we've ever seen, in particular on the prescription drug coverage. So you need to call your agent and check with them and see, is anything changes? Are my copays changing? Are my deductibles changing? Is my out-of-pocket limits per year changing? And how's my drug coverage for this year? Is my drugs still going to be covered under my plan? So I would never just let my plan just roll over automatically without asking some of these questions and getting some answers.
Yeah, because healthcare policies, they change from year to year, so things might not be covered the way that you think that they are. All right, we're going to take a quick break. We're taking more of your questions when we come back.